Hi, friend. So I mentioned in the last podcast that I am an introvert, despite having my own podcast, which seems counterintuitive. Anyone who knows me knows that I am definitely an introvert. I have to restore my energy as much as I love being around people, especially those people who inspire me and light me up. But I am an introvert and I do err on the side of, even when I show up, here on the podcast, I show up professionally. And the whole point of this podcast is for changing the message around women's health. But I had this thought this morning that, maybe I should challenge myself to talk a little bit more personally. And I just want to test this out and see how you feel about this. This podcast is not about me by any means, but we all have our personal experiences. My thought is maybe in sharing my own story a little bit, I promise it's not too TMI, then maybe you'll feel some inspiration or, just feel maybe a little bit more seen in your own personal journey. So we're going to try this out. So one thing that I have dealt with in my health has been low thyroid function. This is something that I identified when I was doing testing before having my first son, when I was first trying to get pregnant. And if you don't know this about me, I was actually having some fertility struggles because I wasn't having a period when I stopped birth control. So I was having amenorrhea, and it was a 3-year journey to figure this out. And this is my springboard into functional medicine and into the work I do with women's health, because I had that personal experience of, hey, something is off. And my doctors were like, well, your blood testing looks fine. I don't know. Just wait and see. Or, we can always do IVF to get pregnant. That kind of story. And so it really pushed me into learning about functional medicine, learning about women's hormones on a deeper level, and really just led where my, personal and professional journey has come to today. So long story short, thyroid. So as I was doing blood work, and I actually had to do blood work myself for looking at the actual thyroid hormones, T4 and T3. And I noticed that my T3 was low. And this is the more active thyroid hormone. And I was like, wow, this could be impacting me getting my period back, being able to ovulate. And I started on low dose, thyroid, natural thyroid. And it seemed to be doing well. It was not the only thing that helped me finally get my period back and get pregnant, but it probably helped. And so I stayed on it. I stayed on it during that first pregnancy, postpartum. I tried stopping it and seeing where I was. I probably honestly didn't do it in the best way because I still was fairly freshly postpartum. It was maybe like 2 or 3 months after having my son. And my thyroid was still looking like it needed support. My TSH was high. Still not outrageously high, but absolutely, higher than even the normal range. And so I went back on thyroid replacement. And over the years since then, that was about 8 years ago when I first started the thyroid replacement. And since then, I've just stayed on it. And my dose has gone up and down over the years, depending on when I was pregnant with my second son, how my energy was feeling, how my weight was feeling, all of that, with checking into my numbers. And in the past month, I sort of like, "God, I hate that I'm still on this." And I've had this thought in the back of my head of, do I still really need it? Especially as I've learned more and more and gotten more experience in my practice. I've been in practice now for 10 years, which is insane to me because I still feel just like a newbie sometimes. But through my experience, I've seen what is possible with other women and how they can transform their health and their thyroid health. I've had patients who come off thyroid medication, many people. And I'm like, why am I still on this? This is silly. I hate that I'm, having to go to a pharmacy to pick this up. It just feels, not in alignment with how I feel about my health in general. And there's nothing wrong, if you are on thyroid medicine too, don't feel like there's something wrong with that. It's a tool. We have all these tools at our disposal and it's great, but I just literally hate going to a pharmacy. They gross me out. So I was like, I wonder if I still need to be on this. Okay. And I'd kind of been thinking about it. And one day I honestly just like, I'm going to stop this. Now, I don't recommend you doing this. Especially if you're on a high thyroid medication, please work with your doctor. Because I am a doctor, I do silly things like this sometimes because I know that I can monitor myself. I know the warning symptoms to watch out for and everything. So I stopped it one morning and I got blood work done. I made sure I scheduled blood work for 2 weeks later. I'm going to do another. This has been really recent still. So I'm going to do more blood work to keep checking in on it just to make sure. But yeah, I stopped it and I was feeling fine. I kept waiting for symptoms to happen. And, nothing really felt off. Here and there, sometimes I'll feel tired and I'm like, oh, is it creeping up? But then I feel fine today. This morning I woke up, I got some great sleep last night. So I felt raring to go this morning, which is rare nowadays, but so wonderful. So all to say, this is my journey right now with my health and my little exploration. Some things I'm doing to support my health. I'm always giving myself immune support, especially during this time in, the winter season. Everyone has had these little colds around me. I had like a little something going on that I was fighting last week. So I'm doing a lot of immune support with like zinc and vitamin C, NAC. I've been doing a lot of antioxidant support in general. Antioxidants are what combat that like wear and tear on our cells, really undoes that aging process, that, that damage that happens. So I've been doing a lot of antioxidants lately. And I've also just like been doing detox support. When I say detox support, I really mean, things that help liver support, prioritizing cruciferous vegetables like broccoli, cauliflower, all of those things. Those have been on my radar lately too. So I've been doing a lot of that and really just making sure that I'm being mindful about what my body needs, nourishing myself with good food, all of that, prioritizing sleep. I'm a big sleep lover. So I'm always prioritizing it. And my kids sometimes don't get that memo and still wake me up through the night. But those are the things I do to support my health. And I've also been doing red light lately, and particularly kind of like around my neck and thyroid area, with the thought of, hey, maybe this will help even more. Now, I love red light in general. And one thing to note is that you don't have to put red light directly on the part of your body that is a concern. There have been so many studies which are so fascinating to me that red light, even in another area of the body, can have an impact on the cells in other places of the body. So there is this cool effect that is just like universal through your body when you're getting red light exposure. But that's another thing that I've just been really like extra diligent about lately, because why not? It also feels really good when it's a little bit chillier. It's just like feels so warming and comforting. And I've been journaling more regularly lately too. And so it feels really nice to just like sack those habits and be able to do red light while I'm journaling before bed. And that can also help with just like really restorative sleep and everything. And it seems like it's been working well. Again, maybe I just didn't need the thyroid hormone anymore anyway because of all the things I've been doing for my health in general. But when I did the blood work, it all looked normal, which is exciting and amazing. So cool that I'm off a pharmaceutical, at least for now. Like I said, I am going to be doing some retesting just to make sure, because while I think how we feel is arguably the most important thing that we can look at with our health, our intuition into our body. But I also don't want to ignore things because sometimes things can creep up silently. So I'm also going to be doing repeat blood work just to make sure that it's still looking good. And I'll keep you posted on that. If you want to hear an update, feel free to message me. You can email us at info@drmirandanaylor.com. That's DrMirandaNaylor.com. If you want to email me directly and just tell me if you liked this episode, if you like hearing my personal journey, if you want an update, let me know, because I don't want to tell you things that you don't want to hear about. Or you can comment on the podcast wherever you're listening to this, or on YouTube if you're watching this. And just let me know, because I'd love to hear your feedback about whether this is interesting to you or not. And I'm happy to give more personal insights, as well as talk maybe more about patient cases as well. Of course, not giving any personal information away, but I'm also happy to talk about examples. If stories and examples are helpful to you to get some more insight, I'm happy to share those, because it really is incredible. I'm inspired every day when I work with my patients of just how incredible their transformations are. And especially, I think the thing that I am so most inspired by my patients about is just like the dedication that I see in the little things in life. It can be so hard to keep showing up for ourselves when we're not seeing results right away, to just trust a process and to see it through. And so when I see my patients just like plugging away, okay, I'm taking the supplements, I'm doing the, diet changes, I'm prioritizing the things. And when they do that, when they just really have that trust, oh my gosh, their transformations are incredible. And they come back to me like, wow, I never knew I could feel this amazing. This is awesome. And that, again, is just so inspiring to me also, because I think like we're all human, and it can feel so hard to trust our body when it's not feeling great, to, be able to show up for the little tiny changes that don't feel groundbreaking and like trust that that is going to change our life because it can and does. So anyway, I hope you were having a wonderful day. I hope you enjoyed my little personal conversation here, and I'll talk to you soon.